When it comes to mental health care, we're at this incredible turning point. For way too long, treatments for really tough conditions like PTSD and severe depression have kind of hit a ceiling. But now, we're seeing this wave of radical, even controversial new ideas, from psychedelics to the digital world. And honestly, it's making us question everything we thought we knew about healing the mind.
All right, so here's how we're going to break this all down. First, we'll get into why this revolution is so desperately needed by looking at the limits of what we're doing now. Then, we are going to follow the unbelievable winding journey of MDMA. After that, we'll dive into the neuroscience, how this stuff actually works. Then, we'll check out the parallel universe of digital therapy with AI and VR. And finally, we gotta face the music, the very steep, very real climb that lies ahead. So let's start with the big why. What's pushing this urgent search for something new? Well, the tough truth is that for a huge number of people, our best conventional therapies just haven't worked. They've hit a brick wall. And look, this quote from Dr. Christina Kusin, it just gets right to the heart of the crisis. We're not talking about treatments just being a little bit ineffective here. We're talking about a third of the patients in her clinic who have tried everything, all the medications, sometimes even really intense treatments like electroconvulsive therapy, and they've got nothing to show for it. They are, and this is the really stark part, literally out of options. And what makes this all even harder is that mental health is almost never just one single, neat little issue. A massive 65% of people dealing with major depression are also fighting at least one other condition, maybe PTSD or a serious anxiety disorder. It's this complexity, this tangled web, that means a simple one-size-fits-all pill just isn't going to cut it for a lot of people. So, with the standard playbook failing so many, researchers had to start looking in some pretty unexpected places. And that brings us to one of the most promising and, most controversial candidates out there, MDMA. Its journey from a forgotten chemical on a shelf to a potential medicine is seriously one of the wildest stories in modern science. Just look at this timeline. It is pure whiplash. It was first made way back in 1912 by Merck, and then just sat on a shelf, forgotten for more than 60 years. Then in the 70s, this chemist, Alexander Shulgin, rediscovers it and sees its therapeutic potential. His wife, Anne, even called it penicillin for the soul. But by the 80s, it got out of the lab, got rebranded as ecstasy, and became the soundtrack to rave culture. Of course, that led straight to it being criminalized in 1985. It took decades of hard work just to bring it back from the fringes and into a serious scientific lab again.
And this really shows you the cultural mountain that researchers had to climb. Even after it was banned, recreational use just exploded into this global thing. We're talking an estimated 20 million users in 2022. That really deep connection to clubbing and parties created this powerful stigma that made the very idea of it being a serious medicine seem totally absurd to a lot of people.
So this begs the big question, right? How on earth could a so-called party drug possibly treat something as deep and painful as trauma? Well, the answer isn't in the culture. It's in our biology. It's in the brain. So let's take a look at the neuroscience. Okay, first, and this is absolutely critical to understand, we are not talking about people just taking ecstasy and hoping for the best. Not at all. We're talking about something called psychedelic-assisted therapy, or PAT. This is a super structured process where a precise dose of pure clinical-grade MDMA is given in a totally safe environment with trained therapists right there guiding the person for the entire session, which can last for hours. So what is actually happening in the brain during this process? Well, it all comes down to a neurotransmitter you've probably heard of, serotonin. MDMA basically does two things at once. It cranks open the floodgates, forcing your brain cells to release a ton of serotonin. And at the same time, it blocks the vacuum cleaner that would normally suck it back up. This massive serotonin flood is what creates those feelings of deep empathy, emotional openness, and connection. And this is where the real therapeutic work begins. See, for someone with PTSD, the brain's fear center, the amygdala, is basically stuck in overdrive. MDMA helps to turn down the volume on the amygdala. At the same time, it boosts the connection to the prefrontal cortex, which is like the brain's CEO, in charge of logic and regulating emotions. That combination lets a patient revisit traumatic memories without that feeling of overwhelming terror that usually comes with them. The fear gets turned down, and a window for healing finally opens up. And the results from this approach? They have been nothing short of extraordinary. In the big Phase 3 trials sponsored by MAPS, that's the Multidisciplinary Association for Psychedelic Studies, The effects were just profound. After only 3 guided sessions, over 71% of people saw a major improvement. And get this, a huge chunk of them no longer even met the criteria for PTSD anymore. That kind of result is almost unheard of in this field. But here's the thing. This revolution isn't just chemical, it's also digital. At the very same time all this is happening, technology is creating a whole parallel track of innovation, giving us powerful new mental health tools that don't involve any drugs whatsoever. Yeah, the two big players here are artificial intelligence and virtual reality. Now, instead of altering your brain chemistry, these tools work by reshaping your experiences and gathering data in ways that were just impossible before. It's a move toward a new kind of precision medicine for the mind, where treatment can be custom-tailored to exactly how an individual behaves and reacts. It's really helpful to compare these two new frontiers side by side. Psychedelic-assisted therapy, PAT, is biochemical. It works from the inside out, changing your brain chemistry to open that door for emotional healing. Digital therapies, on the other hand, they work from the outside in. They create these super-controlled virtual worlds where a patient can safely confront their fears. Like with VR, someone with a fear of heights can stand on a virtual skyscraper in a way that's totally safe and manageable. And AI can analyze things like speech patterns to give a therapist objective data on a patient's progress, something that's always been subjective before. So we've got these two incredible, revolutionary paths opening up. And believe me, this is a huge but. The road from promising research to being available at your local clinic is incredibly steep. It is full of obstacles. Let's just start with the whole idea of danger. A really important study from 2010 tried to rationally rank the harm of all sorts of drugs, and their conclusion was just stunning. When you factor in everything, harm to the user, harm to society, MDMA was found to be way less harmful than legal, totally socially accepted things like alcohol and tobacco. This scientific reality is in a head-on collision with its public reputation. And that collision came to a head in June 2024. Despite those powerful trial results, despite the data on its relative safety, an advisory committee for the US FDA voted overwhelmingly against recommending MDMA therapy for PTSD. They pointed to concerns about gaps in the data and how the trials were run, a decision that just floored the research community. This really shows you the fundamental tension here. You have desperate patients with no other hope on one side, and a cautious regulatory body whose job is to ensure safety and rigor above all else on the other. And you gotta understand, that FDA vote is just one piece of the puzzle. The cost alone could be astronomical, putting this out of reach for almost everyone. There's also a massive infrastructure problem. We just don't have enough trained therapists or the right kind of clinics. And on the digital side, AI and VR have their own issues with the cost of the hardware and, of course, the huge ethical questions about data privacy. So this is the question that just hangs over everything. We have these tools with the potential to heal trauma and literally transform lives in ways we have never seen before. But they are clashing head-on with these immense financial, regulatory, and cultural walls. Will we find a way to navigate this incredibly complex new world and finally cross that threshold? Or will this incredibly promising future for millions of people just remain out of reach?